Hi, thanks for joining us. My name is Wes Wright. I'm the Executive Director of the Next Generation 911 Institute. The Institute, if you're not familiar with us, is a nonprofit organization. We support the efforts of the Congressional Next Gen 911 Caucus. And our mission, it's fairly straightforward. Our mission is to assist the Congressional Next Gen 911 Caucus by serving as a broad educational resource on issues important to the effective operation and advancement of NG 911 services and systems. The overarching objective is to advance the rapid implementation of NG 911 in order to promote more efficient emergency response and improve public safety. To this end, we seek to educate members of Congress and their staff on public safety issues and things that we can do to more effectively implement NG 911. The caucus is co-chaired by Senators Amy Klobuchar of Minnesota and Ted Budd of North Carolina, and Representatives Richard Hudson of North Carolina and Anna Eshoo of California. It's the only bipartisan, bicameral organization dedicated exclusively to NG 911 issues, and it plays a unique role in raising the visibility of policy matters and other funding needs. So before we get to the content of our program, I just wanted to take a quick opportunity to thank our board members, several of whom are participating in this webinar today. So I appreciate you guys. Your work on the board is important. It's been invaluable. I'd also like to thank our sponsors. We have a list of our sponsors on the website and also as part of our newsletter, and then we honor them at the Honor Awards, things like that. But if you have questions about who the sponsors are or the issues, feel free to let us know. And then also just thank them for making this possible. We had planned this webinar a while ago, but as we were finalizing the agenda, the Pulse of 911 survey was released. This survey included some really key insights around the extent to which our nation's 911 centers are understaffed, face technology challenges, and report high workplace-related stress. There are many reasons for these troubling trends, and our panelists include representatives from 911 centers, 911 Wonder Woman, APCO and NENA, and they're going to talk about these challenges in more depth at the local level and then some federal initiatives that are being undertaken to address some of the concerns. We're trying a new format for the webinar, so I've asked Monica Million, who's actually also on our board, and the founder of Million Consulting Services, to moderate essentially two panels that are going to focus on health and wellness challenges and initiatives that impact our 911 centers. As I mentioned, Monica is the founder and CEO of Million Consulting Services. Her experience and commitment to service spans 24 years, beginning with her role as a 911 public safety telecommunicator. She worked her way up to managing a regional 911 center and served as the first civilian deputy chief of services for her municipal police department. Monica concluded her government service as the executive director of the Colorado 911 Resource Center, serving 86 911 centers across the state. She was most recently the 911 subject matter expert for Amazon Web Services, the Justice and Public Safety team, where she was instrumental in deploying solutions in PSAPs to help mitigate staffing shortages, analyze dispatcher mental wellness, and ultimately save lives. She's also a past president of NENA and a NENA Hall of Fame award recipient. In her time with NENA, Monica was instrumental in establishing the Collaborative Coalition for International Public Safety. She's also the co-founder and co-chair of the Women in 911 Alliance and for the Collaborative Coalition for International Public Safety. She serves on the board of advisors for several organizations, Valor Vacations of Colorado, Source One, and Women in 911 Alliance. In her spare time, to the extent, Monica, you have any spare time, you speak at regional, state, national, international events to advance 911 and emergency number services worldwide. And I'm going to quickly introduce our panelists, and I promise I'm going to shut up and turn it over to you, Monica. Joining us today, we have Heather McGaffin, the director of the DC Office of Unified Communications, Scott Brillman, the director of 911 Fairfax County, Mark Reddish, senior counsel and manager of government relations at APCO, Jonathan Gilled, VP of Government Affairs at NENA, and Sarah Weston, the executive director of 911 Wonder Woman. The last plug I will make, particularly for Hill staff, is that Heather has agreed to open her 911 center to us in mid-June for another tour. The Institute did this last year. We arranged transportation for Hill staff and lunch for any interested staffers. And then you can go tour the center, learn more about it. And it was a big hit last year. I hope that we can have even a better turnout this year. So I'll follow up with your offices individually to extend the invite. But if this is something that's interesting to you, please let me know and we can make sure you're on the list. So with that, if you have questions as they come up, feel free to put them in the chat or the Q&A bar. And please take it away, Monica.
Yeah, thank you, Wes. I'm really honored to be facilitating the panel. I have mad respect for all of our participants. And I really became passionate about this topic when I was a director at my center in Western Colorado, probably clear back to 2011. And really, mental health and wellness of our frontline folks really hadn't come front and center in our profession, really, frankly, it was only within the last 5 or 6 years, which is really unfortunate because one of the things that I started to recognize was some of these impacts of vicarious trauma and, frankly, PTSD in some of our team members. And really, I got introduced to Dr. Michelle Lilly, Jim Marshall, real leaders in this topic in our profession. So I'm excited to hear what our panelists have to say. As Wes described, we're going to have kind of a two-pronged approach to this topic. Our first panel is going to be our directors, along with Ms. Sarah Weston, talking about really the frontline experience. And then from our associations, we will be hearing from those folks about really what is happening on the Hill as far as legislation and other initiatives that can help get our folks protective services classification, which would help in aligning some mental health resources for our folks. So to kick it all off, I'm going to kick off the first question to Heather, Scott, and Sarah. And maybe Heather, you can take the question first. How does the fact that the call takers in your center not being classified as first responders impact them? And Heather, if you can go first, and then I'll follow on with Scott.
Sure. So thanks so much. I'm in Washington, D.C., so we have one public safety answering point, or ECC here, and we have about 250 folks that directly touch 911, either in a call taking or a dispatching role, and they're not considered public safety first responders. And so we are working really hard this year, especially to get that resignation and that designation. But they don't benefit from some of the same things as their counterparts in police or fire do. First-time homebuyer incentives, access to clinics that the police and firefighters have here in Washington, D.C. But one of the things that we talk about is when you join MPD as a police officer or DC Fire and EMS as a firefighter or paramedic, if you grew up here in Washington, D.C., what they do is they don't really put you in your neighborhood. So when you're dealing with emergencies, you don't have that maybe direct connection, but we don't have that capability here. So our folks are answering calls for really traumatic events that involve their neighbors and their family members. And so what we're having to do is really having to self-resource here. And so for me, that's the biggest thing. It's certainly about the designation and the recognition for what they do day in and day out, but it's being able to provide them a clear pathway without a lot of roadblocks to the resources that they need to make sure that they are well to do this job so that they can really follow in this career path. And after 3 or 5 years aren't looking to go do something that is less stressful because they're really good at what they do.
Right. Scott, how about you? How does it affect the folks in your center? And please share for the audience where you're the director at.
Sure. Fairfax County. We take about 1.2 million calls a year here in our center. We have about 200 folks, just like Heather, and we're challenged with the same thing. We are not recognized as first responders, and I want to give a shout out. I came from Maryland. I want to give a shout out to Senator Kagan and Steve Souter. I don't know if they're on this call, but if they are, they did awesome things in Maryland to get them recognition and services, mental health services and other things they need. And they equalized us with fire, police, and sheriffs in Maryland. So shout out to them. And I also want to kind of paint the picture for those folks on the call that are new to 911. Our 911 folks, for the first 5 or 10 minutes of every emergency call, are in charge of the call. They are the first responders handling every kind of emergency, whether it's a shooting, an assault, a robbery, a childbirth, a fire, a behavioral health emergency, they're handling that. And it takes a huge mental and emotional toll on our folks, both short term and long term. And we're starting to recognize that. And in the fire service, which I come from, there's been studies of firefighters and cancer and mental health and even waking up in the middle of the night. Tons of studies and advocacy around the fire department, but not so much our field in 911. And if they recognized us as first responders, we would get more focus on those types of issues. So health and wellness benefits, retirement benefits, that would help us if we were recognized as first responders.
Yeah, exactly. And Sarah, you get to travel all over the country. And frankly, I was fortunate enough to share some stage space with Sarah last week in Valencia, Spain, during the European Emergency Number Association event. Sarah, I know you talked to a lot of first line telecommunicators in our space. Maybe you can shed some light on the question too about how you think the fact that our frontline folks are not recognized as first responders and how that impacts their mental health.
Absolutely. Thank you, Monica. Yeah, that was fun last week. Let's do that again. So my organization, we were founded in 2019. So that was kind of the year after BLS had determined that 911 wasn't a protected class, going through that whole system. So it was an interesting time to be having this conversation after kind of being told no. And a lot of folks were talking about this, right? Also, 2019, the year before COVID hit, which put a lot more aspects of being a first responder out there. For example, a lot of states were not able to get vaccines for their people working 911 because they were not first responders. In my state, grocery store workers were given vaccines prior to dispatchers. So who's going to answer the call? When we think about first response, I like to think about it like a thread. If this thread gets chopped at any spot, the first response does not happen. And as Scott said, that starts with the folks answering and managing the calls, right? So access to vaccines, access to PPO, like all of these things that the police, fire, EMS was getting, and people weren't thinking about 911. And that's one of the things I always go back to. We didn't see this coming. We did not see a global pandemic coming. So what else is there that our 911 professionals would not have access to should it happen? I mean, things we can't even imagine, right? Along with Scott was talking about access to resources, grants. There's a ton of grants available for first responders at the federal level, at the state level, that 911 isn't automatically qualified for, depending on how they're classified in that state. So this also goes back to retention, with the retirement benefits, with pay, with recruiting, with understaffed. This has so many ripples that I don't think a lot of people think about, other than the, yay, we're first responders and we're very proud of that. And they would be, but there's so much other issues behind this.
Yeah, I really appreciate the fact that you brought up the pandemic, because during that time in Colorado, I was the state 911 office per se, because we're a home rule state. We don't have that equivalent, but I had to argue with the governor's office to get PPE for the dispatch centers. And I'm like, this is ridiculous. So I really appreciate that you brought that perspective to the response. Heather, can you share?
Monica.
Oh, yeah, go ahead.
Real quick, Sarah sparked a memory during COVID where there was a pay incentive for folks coming into work every day and taking a risk, right?
Yes.
Everyone else stayed at home. and was able to work remotely. And fire, police, and sheriffs got this pay incentive, and the folks coming into centers to answer 911 calls did not,
Correct.
because we were not first responders, even though we were taking a huge risk being in a center, um, like, and taking calls. And so
Yeah.
just sparked the memory. Sorry to interrupt.
No. That's again another super valid point, and just drives home how important it is that we get our telecommunicators classified into protective services. I appreciate that input, Scott. Heather, can you share with us what you think, or how you think the job as a 911 call taker has changed over the last not just 20 years, but 10 years?
Absolutely. So I started as a call taker, also in Maryland. So Senator Kagan, I know you're on. Thank you for everything you've done for that profession in Maryland. So when I started, there were no protocols. When people called 911, you literally just looked at a screen, you saw the address that they were coming from, and that's where you sent first responders. Cell phones, I'm dating myself, cell phones really weren't a big thing. People called from payphones, and you would just have the responders meet them at the payphone, and then typically they would follow, the folks to wherever the emergency was. And then we got protocols, and then we were keeping folks on the phone longer, and we became a more intimate part of the emergency. We weren't really just on the outside of it, right? We were giving CPR instructions. We were listening to parents cry or give life-saving, measures to people that they loved. We were delivering babies. We were doing all the things that I don't think we maybe realized we would be doing when we signed up for those jobs. And then over the past several years, especially post-COVID, mental health calls have drastically increased. And so now we're, trying to literally talk people off of ledges of bridges or windowsills before we can get someone on. And, we didn't go to school to be negotiators or to deal with these sensitive subjects. So we're playing catch up, because what we're doing is, while we're trying as leaders to foreshadow the emergencies that we're going to see, at some point it really outpaced us. And so now we're really trying to catch up. And what I think I didn't realize until I met Jim Marshall in the summer of 2020, and I was honored and lucky enough to be able to do a podcast with him when I was working in the private sector, was that some of the things that I was saying, he was like, Heather, you have trauma from some of those calls that you took years ago. And so, we are recognizing it now. I think Dr. Lilly, Jim Marshall, I think a lot of people have done a lot of work around that. But now as leaders, again, we're kind of finding ourselves in a place of like, how do we try and go back to just help them for moving forward, but to correct years and years of neglect of the well-being of the people who are doing one of the most important jobs in this country. And so, I think that's where we are.
Yeah, I agree 100%, Heather. And just because you touched on it, I'm really going to share some data from the Pulse of 911 report that came out that Wes referenced at the start of the webinar. And really in that information, respondents said, 90% of the respondents said that their agency provides services, but the sad fact is only 18% of those respondents said they're taking advantage of it. And I still think that there's some kind of stigma surrounding getting help of some kind. And we have to continue to try to normalize what that looks like. And that's the other component I think that's really changed in our universe, if you will. Scott, do you have some input on how you feel like the role has changed over the last 10 or 20 years?
Yeah, I mean, that survey was great, by the way. And
Yeah.
I'm looking at it now, and it says 68% of people feel stressed every day coming into work in our job. And a couple things to mention here. When I first started in 911, I think there was less screens, right?
Yes.
Less data, certainly less calls. But now we're tasking our folks to look at tons of data that's not easily digestible. Make sure you look at the caller's past medical history. Make sure you see what Uber that is, what direction they're traveling, where this is and where that is, where the alarm's coming from. There's so much information that we're tasking our folks. It needs to get easier. So that's one thing. More calls are coming in. Society's changing. And when society changes, our job changes. The invention of social media has totally changed the way we operate. Somebody can post something on social media, and it can cause us to get 100 calls. Say, hey, I just saw something on Facebook. It's a behavioral health emergency, and suddenly we're being investigators and trying to figure out what's going on. And our partners out there, our fire and police and sheriffs, their jobs are changing too. The way they're policing, fire department is changing the way they run EMS calls. And so whenever those agencies change, we must change with them. And so we're human. Like our folks are human, and you can only take so much change in a day. But there's a lot of stuff going on, and it puts stress on all of our folks, all of our
Yeah,
first responders in the 911 center.
exactly. Sarah, you've been in the profession for quite a while, and really through your work with 911 Wonder Women, you've really seen the dynamics of the role change based on your travels and the folks that you speak to on a daily basis. What do you see the change looking like over the last 10 or 20 years?
So I, along with being the executive director of 911 Wonder Woman, I've also been a 911 technology consultant for 20 years. So I started in 2001, which was like right when like everyone was starting to get a cell phone. We were moving to phase two. So we were kind of trying to fix the 911 system so it could accept wireless calls at the time. And we were talking about this concept of next gen 911. So yes, we've been discussing next gen 911 for 20 years now, at least, I'm sure even more than that. So, but as we go, things are changing, right? So I like to think of next gen 911 now as it's not a destination. It's just the fact that things are going to change consistently as we go, looking into the future. For example, the smartphone, when that came into 911, that's a lot of what Scott is talking about, is like the amount, the volume of calls, but also the way in which calls come in and what dispatchers are taking in and what they're having to see. So as that job has changed and become more and more technical, not only do you have to be technically savvy, but you have to have all of the smarts and education of the investigator, the fire, the EMS side of things, how to do CPR, how to do the protocols. We haven't seen much change in pay, benefits, working conditions. And what I've seen is new technologies come in and make certain tasks more efficient. So a 911 professional can get information in and dispatch quicker. But instead of making their job less stressful, we keep adding stuff on top of that, right?
Right.
Scott said, like, we're human. 911 professionals are not an iPhone. You can download a new operating system and now they can use all this technology. There's training that has to come, that we have to think about the consequences. That's when mental health professionals come into play too. So as videos coming into 911 and pictures, we know it's a good thing. We know it'll help save lives and improve outcomes, but not if the person receiving that information is too overwhelmed to deal with it because of the short staffing, because the pay isn't great, because of the conditions. So the job has changed, technology has improved and made our systems better, but we're not looking at the human aspect of it as much as we should be to help bring them along in order to make that good technology useful and helpful and save lives and improve outcomes.
Yeah, I agree 100%. And Heather and Scott, I'm going to direct the next question really just to the two of you. And how do you think those changes, Heather, if you'll respond first, how do you think those changes have impacted the mental health of your staff?
We're taxing them, quite honestly, because, you know, when you talk about bringing in something new, you also have to help them kind of learn, kind of break the old way of doing things, if you will. And so that's hard too, because what you have, or what I have in my center, is about 5 generations of people. So I have the 18-year-old who just graduated last May and is, this is their first step into the workforce. And then I have folks in their 70s that are still, that have been doing this for literally 50 years. And so we have this large spread of people, and we've really just transformed how things have happened. And probably in 911 faster than anything else, right? I mean, when you think about how long the fire department has been around or how long the police department has been around, and then you just think about only how long 911 has been around in comparison, and then you look over those 55 years, and then you see how much change we've had, it's pretty fast. It's like we're rapidly changing. I think too, when we talk about what we're doing to them, is as a society, we're putting an expectation that's unrealistic. I'm going to be in the worst moment of my life. I have zero idea where I am. I don't even really know what's happening. But now you handle it all and you figure it out and you do it and you stay kind to me while you're doing it and you figure it all out and you get the responders here. And I think one of the things that we have done or really tried to focus on is public education and expectation. Because also, I think for a long time across this nation, once we put out this 3-digit number, it became the catch-all to everything. So I'm fortunate to have a 311 for non-emergency, and we certainly will put people, if they call 911 and it's not an emergency, we will push them to 311 for that to be handled. But I know where I came from, that wasn't the case. So if, somebody's water got cut, if they came home and their water had been cut off by water and sewer, they called 911 and we just dealt with it. And so I think we, to Sarah's point, we just keep piling things on, but we're not really taking anything off. And so we've upset that balance and now trying to figure out how we can rebalance the scales and then certainly provide assistance and take away the stigma.
Yeah. Good. All valid points. Scott, what have you seen with your staff regarding the changes and how it's impacted them?
We certainly feel the stress of all this new technology. And Heather mentioned generational differences, and there's certainly generational differences in how people learn new technology, but also how they handle the stress. And I came from a generation where we buckled up, we're strong, and we powered through no matter how bad the call was, and we came back to work the next day. And that created a stigma that it's not okay to ask for help. And that's not the case these days. And we have a new generation that we're trying to teach that it's okay to ask for help. It's okay to reach out to your supervisor or a friend or all these services that we provide. Even if it's just doing a brain dump after your day before going home, saying, I took 10 terrible calls today. I want to tell you about it, and go home and not take it with you. And so, but we're fighting a whole generation that wasn't like that for many, many years. So it's definitely a challenge. And in the center, we're seeing absenteeism. We're seeing a lot of people get sick. We're seeing some attitudes, exhaustion, performance issues. And so we're battling that now, and
Yeah.
it's a huge challenge.
Yeah, I often describe our folks as the most selfless component of the public safety ecosystem, and that might be a little subjective to some, but I don't care because I understand what has happened to them and what continues to happen to them. Scott, maybe for the audience, you could explain this phenomenon called swatting and really how that is beginning to affect our folks and what impact it has on the center.
Yeah, I mean, the simplest form of describing this is faking a 911 call. And our first responders that work in 911 centers they come to work, they are so focused and dedicated to saving lives. When people call in fake calls, it's not only, it's a burden on their mental health when that happens, but it's so dangerous for all of our first responders and society together. And these calls have been increasing that I've seen over the past few years at dangerous levels.
Heather, how about for your center? How has your center been impacted by swatting, and if so, what does that look like, or what has that looked like for your center?
So if anybody knows Mark Fletch from this industry, every time he talks to me, he's like, Heather, what's the number up to now? And it's well over 200. Since January 1st, we've taken over 200 swatted 911 calls. And that's just because certainly of where we are and who lives here. So it is really taking a toll. We're training. And it's one of those things where it's been around for a long time, and I think we see it in waves. Like, I think the last big wave was 2020. Then last summer, we saw a couple of instances of it. But this year, it's just absolutely out of control. And I think it kind of plays into the mental health this way. Certainly what Scott said, but also it's the laws that allow these types of incidents to happen without prosecution. And so they continue to happen. And so when we talk about the mental health of our call takers and our dispatchers, it's not just about the services that directly touch them. It's about the laws and the policies that make their job a little bit easier. Because if you knew that if you swatted, that there would be tough consequences, maybe the next person's not going to do it, or they're going to think twice about it. Maybe not, but I think that that's just another kind of protective layer about how we protect that. And it also, for our call takers, when I talk with them, they're like, we kind of feel like we're in this situation. Like, do we believe this? Do we not believe this? Do we send everybody out? Do we not? And so certainly as leaders, we're doing some things on the side in Washington, D.C. So if you live here, you have a presence here, you can reach out to us and we can add your address to a swatting database. And so we put those notes in CAD, and that helps our call takers. But we need a solution that solves the problem long-term, and not just, we're one PSAP of over 6,000, and this is what works for us in this moment. So just trying to find a solution that works for everybody, and will kind of just stop the problem holistically and not just for a moment in time.
Right. And for the audience members who don't know, 911 is a local control issue. So oftentimes as we're trying to vet or produce legislation that would help prosecute in some of these kinds of circumstances, some directors are not well versed in writing legislation or getting in touch. So we reach across the country to our peers who have been successful in creating legislation. I'm just calling that out because for 5 years in Colorado, we've been trying to get something passed for abusive 911 type calls, and swatting, of course, is called out in that. And we still cannot get the legislation past the finish line in my own state. So it's a challenge, that's for sure. But again, impacting the very people who are expected to make split-second decisions on, is this a valid call? Is this a fake call? To Scott's point, am I putting responders in danger by sending them into an unknown set of circumstances? And it's really kind of a precarious situation. And there's so many opportunities for bad actors to use the latest technologies against us, which I think is going to be a great segue into one of our final questions to this panel. And maybe, Scott, I'll go to you first. And we've kind of touched on all of the ways the technology has hindered or assisted our folks on their mental wellness journey in this profession. Is there some other piece that you'd like to refer to? Is it a network component? Is it like the overarching, all of the new data sets coming in, and how can we navigate that and mitigate the impact to our folks? Do you have some ideas on how you're doing that in your center?
Well, when it comes to technology, one thing we're not hearing these days is, well, where are you? Where are you? Because telecom companies and our tech companies out there are delivering better locations, and so that's helpful to our folks, not taking minutes trying to figure out where someone is, and the call is a little less stressful in that manner. But all the other data, like I mentioned before, is an added stress. And I think telecom companies and our vendors need to get better at organizing all this information, maybe using AI to deliver it to our folks in an easy, digestible way, that we can just focus on saving lives and that one caller and not a bunch of screens and data coming in.
Yeah, I remember, I was a director years ago, but even back then, the conversation, as Sarah pointed out, we've been talking about next gen for 20 years. And as we began to imagine what kinds of data sets would be able to come into our centers, as a director, I was like, oh my gosh, I cannot give them 300 additional pieces of data without having some kind of aggregation point or something to ingest the information that would actually be actionable for a responder. So I really appreciate. Heather, what about you? What's your perspective on how these advances have helped or hurt our folks?
So, I think it's about how we educate them to use it, really. I think when you're a call taker, and I can remember like being a call taker and hearing about Next Gen 911, and I'm like, what in the world? Or we hear about things like, oh, you're going to start seeing video, or you're going to start seeing still pictures, and all of this is going to be brought into your center. People were like, wait, this is not what I signed up for. And I think one of the things that we realized along this journey of Next Gen 911 is that our job descriptions never have really been updated. And so if you haven't, you should take a look at 911.gov and the Telecommunicator reclassification toolkit. Because one of the things, I worked on that in the private sector, one of the things that we found were there are people sitting in seats and PSAPs across the center, and the job description was older than they were. And so the game has changed, and we need to be really honest about that. And I think we need to be really honest with ourselves, with the folks that we're hiring, about what the expectation is. And it's not just for today, it's for the future. So when we do start taking those things, or when we do start passing those things through our centers, we're hiring people who understand that that is what the job is. Because I think what has happened is we made 911 really robust from a technical standpoint, and maybe forgot about the people who are under the headset in all of that. And so we've been working really hard here at OUC to educate from the next gen point of view, as I know, all my neighbors in this national capital region have been as well. And so I really think that education is the key part. I think people will do, and they understand that the job is changing. They just want to really know what the expectations are. And so I think if we level set that and we just start saying, this is a hard job, this isn't easy. Yes, you get to be the hero some days, but most days nobody cares what you did,
Right.
from the outside. And one of the ways we're doing that, and I'll share this, is we have something now called Prospect Day for hiring, which we could do a whole nother panel on hiring in today's 911 world. But one of the things that we've been doing is we've been pairing people up with current call takers to really help them understand the job. So if somebody's like, I'm a single mom with 3 kids, we're finding the single mom with 3 kids so that they can really talk about what this job means and what that means, because wellness doesn't just stop or start at our doors. It's how well they're doing out there, because if they're not well when they're stepping on the sidewalk out front, they're not going to do well in here. And so that would kind of just be my closing piece, is that when you talk about wellness, you have to make sure that your employees are resourced, that there's food on their table and their lights are on, and they're not sitting here worrying about, it's 12:41, who's going to pick my daughter up from school at 3 o'clock because I didn't figure that out and I might have to call out sick, or say I'm sick to go. And we just have to look at call takers as the humans and the people they are, and help them meet their needs if they're struggling in that way.
Yeah. Well said, Heather. Well said. Now I'm going to kind of take the conversation in a little bit of different direction and bring in Mark and Jonathan and Sarah. I'm going to call you in on a couple of these questions also, and really start to talk about at the federal level what our associations are doing, and then how we can help in those efforts. But first, Mark, if you wouldn't mind explaining for our audience what the 911 Protect Act is and how it's going to help address the mental health issue in our profession.
Thanks. I'd love to talk about that. It's a great bill, and it's probably the bill most related to wellness issues for the 911 community because it's targeted toward this community. So it was introduced by Congresswoman Robin Kelly and Congressman Brian Fitzpatrick, bipartisan bill, and it would do 3 things. One is establish a grant program so that ECCs could either create new resources or improve the resources that they already have to meet the wellness needs of their personnel. 2 would be tasking a branch of the Department of Health and Human Services with developing best practices for how to prevent PTSD and mitigate PTSD when it happens for 911 professionals. And then the 3rd piece is guidance for clinicians, because I repeatedly hear that it's a major problem. Someone's suffering. You convince them to seek professional help. And they go in and maybe they even end up consoling the mental health professional who had no idea what they were getting into, talking to someone about 911 operations. And you're not going to go back, right? It hurts. It hurts the culture around willingness to go and seek out help. So anyway, it's a fantastic bipartisan bill. It's in the House. We're trying to get a companion in the Senate. And if I could, I promise I'm not going to always be long-winded, but I have some statistics that help put the need in context and I think quantify what we've been hearing about so far.
Yeah,
So
please share. Please share.
there was this nationwide survey of public safety professionals run by the U.S. Marshals Service. And I think they surveyed several thousand professionals across the public safety disciplines, including 911. And here's what they found. More than 50% of 911 professionals responded to questions in a way that indicated they had clinically significant signs of depression, more than 50% clinically significant signs of anxiety, and 18% showed clinically significant signs of PTSD. So basically 1 in 5 people, if you walk into a center like OUC, you're talking about, 50 personnel, right? And the worst statistic is that according to these survey results, 1 in 7 911 professionals reports recent thoughts of suicide. Yeah. So it's just so alarming to think that there's this much suffering happening in silence, but I don't want to be completely negative about it, because at the same time, we're hearing about the change that's happening. And it's not just areas like DC and Fairfax. This is a growing cultural shift, at least as I'm seeing.
Yeah, it is, Mark. Thank you for sharing that information. Jonathan, maybe you could speak to the 911 Saves Act and how federal classification is different from state level classifications, and really then how that could impact us in our ability to get wellness tools and benefits.
Sure. So the 911 Saves Act, we have bills in both houses. In the House, it's led by Representative Norma Torres and Brian Fitzpatrick, so also strongly bipartisan. And in the Senate, the leads are Senator Klobuchar and Senator Blackburn. So once again, in both houses, it's a pretty strong bipartisan bill. The main emphasis of this bill is to just reclassify 911 professionals as public safety protective service personnel. Now, immediately, the impact wouldn't be on any kind of federal programs or anything. However, the most immediate impact would be recognition for the work that 911 professionals do every day, that they are part of the public safety community, and they're not just clerical. So that's the immediate thing that can happen. It would, if a state were to do something, or were to classify right now, they would not be able to add public safety personnel or 911 professionals to their public safety personnel retirement programs or benefits. Some states even that have reclassified, even when it comes to their reporting, they have to then separate out the 911 professionals from their public safety community or from their police departments, or however they classify them, they still be separated, and that makes research really hard. So there are a bunch of surveys. I know Mark just mentioned the Marshall Service. There's the 911 Pulse survey that just came out as well with Nina about 911 professionals. One thing we do have that's hard for us to do is to narrow and pinpoint how many 911 professionals there are in this country, because they're not part of, they're considered clerical. So when you do a survey of, I guess, the workforce, they would be wrapped into a much larger category of clerical service. So this bill would help us help 911 professionals get the recognition they deserve, and then longer term allow the states to do as they please, since right now they'd be prohibited by the federal government.
Yeah.
If I hate to be a voice of outrage, but
No,
if I can
go ahead.
elaborate on it,
Yeah.
classification system, I think we first started looking at it in 2014, and as we pulled this string, it got weirder and weirder, right? You look at this thing, the protective service group, it's not just first responders as people would traditionally think of them. It has playground monitors, school bus monitors, the people working in casinos to catch cheaters, right?
Yes.
So it's a protective job if you're protecting the casino's money, but it's not protective if you're coaching someone through CPR. And give me a break, right? So it's pretty outrageous, and we're coming up. It's been 10 years since the last revision was initiated. That's our third go around with a bill in Congress to try and fix it. So I know everyone's tired of working on it, but if we can just keep the stamina and keep the motivation going, I mean, every day it feels like we're a little bit closer. People are understanding what happens in a 911 center a little bit better. And at least at the federal level, it should be an easy argument to make. We're not talking about a bill that Congress is going to write a check for, right? This isn't going to cost the federal government anything. It's not going to trickle down and force new costs on state or local government either, right? If this state wants to change its pension rules, they can do that today. It doesn't matter what the federal classification is. So anyway, often it's helpful on the Hill if you're able to go in and say, I'm not asking for any money on this one. And usually the staff will say, all right, I am all ears. This might be something that we can get across the finish line. So anyway, sorry. I'm
No,
making
please.
good on my plan to be less than long-winded.
I always love it when we get some 911 professionals together, because we're all passionate about it. Sarah, I know you get to advocate quite a bit for our profession. And again, how you've traveled across the country and frankly, internationally to support the industry. What do you think in the country? What's the number one thing that you feel Hill staff could do to help our community?
I believe that Hill staff should go to a 911 center. So one of the things we led with is the site visit. I think that goes a very long way in understanding what 911 professionals do. It is hard to imagine. It's hard to imagine. So educating yourself, I found this in my career too, by me going into 911 centers across the country, that really impassioned me to do more and to do what I could to help them. I know all of our jobs are stressful and we feel that stress every day, but there's something about those people in the centers that you don't understand until you stand in the room and feel it. I also want you to know that this reclassification thing is, we are not just looking for you to take the action. Heather mentioned it earlier. We are trying to update our job descriptions. We found when the BLS did not reclassify us last time and we remained clerical, one of the things we found in research is that the word clerical was used over and over and over again in job descriptions for 911 centers. So we have been hitting the ground running, educating folks in centers like, hey, you have a part in this too. Let's professionalize 911. Let's advocate for ourselves, draw other people in to advocate. And I think, as folks who can do something on the Hill, getting that bug, getting that passion, feeling those pain points will be really helpful for us all.
Absolutely. Jonathan, what do you think is the number one thing 911 professionals can do to advocate for the legislation at the federal level?
So I would definitely echo what Sarah said, inviting staff and their elected representatives to their centers. We find this to be incredibly effective to getting the message across. A picture or an image is worth 1,000 words. So particularly this year, it is an election year. Members of Congress are looking to meet constituents. It is a very important and opportune year, particularly this summer, to invite your members of Congress, invite your local representatives, your senators to your ECC. Also, get your voice heard. Call your member of Congress, write your member of Congress. They need to hear from you. Often in DC, it's usually the people who say no who are heard the most because they're the most passionate. But we know our industry is very passionate. So coming forward and saying, please reclassify 911 professionals. And as Mark said, it doesn't cost any money. It is a very easy bill for members of Congress to sign on for. A lot of them, when they hear about it, like, oh, sure. I haven't, at least from my experience, seen too much opposition to this bill in Congress. What it does need is it needs momentum and the wind behind its sails. And that comes from the visits. It comes from individual members reaching out to the members of Congress.
Yeah. Thank you, Jonathan. And I think as a wrap up, Mark, I'm going to go to you first because Mark and Jonathan representing their associations, and even Sarah representing the 911 Wonder Women, you all have tools in your toolkit, if you will, that will help our 911 professionals in their career regarding their mental health and wellness. And, our whole goal is that they stay in this profession for their lifetime, that it truly is a career. So, Mark, perhaps you could share first what kind of tools and resources that APCO has and where they can be found.
Sure. So APCO does have a website or webpage focused on wellness issues. It's going through a little bit of a revitalization, so it's influx and content's adding and being refined. But at the top of the list, and probably the best resource on it right now, is a best practices guide for peer support programs. And related to that, a white paper that shows some of the research that APCO's Health and Wellness Committee did on peer support programs.
Awesome. Jonathan, how about NINA? What tools do they have and where can those be found?
Yeah, so on the NINA page, we actually have an advocacy section. We do have a click to action through our Voter Voice Advocacy Center where you can send messages to members of Congress and your senators. We have a pre-filled letter, but I encourage you to add in a little bit of your own story to make it more personal. So you can reach out directly to all of your members of Congress. And we'll also be emailing all of our members our updated advocacy toolkit.
And in addition, Nina also provides an entire wellness continuum, if you will, that's found on the website, tools and resources that are free to everybody, whether you're a member or not. So that can also be found on the Nina website. Sarah, you've done so much advocating for the profession. What kind of resources and offerings does your organization have for folks in our realm?
So first and foremost, we offer community. We are a huge community, and we have found through the years that coming together and having the conversation is the first very important step. Reaching out. So it's the idea of peer support, right? Like, I'm having this issue. Am I the only one? And then, no, likely you are not. And here are people from all across the country who can support you, give you resources, point you to Nina, point you to APCO, point you to Dr. Michelle Lilly to figure out what's going on. In 911, we're kind of in these four walls, right? And all we see are the people that we work with. But there's a huge community out there. We also do online and in-person trainings called Finding Your Career in 911. And this is from not teaching you how to take the calls, but teaching you this is how you educate yourself. This is why it's important to get an EMP certification or professional certifications in 911. Here's what you can do, and really develops the person answering the call so that we can get better outcomes and more staff and better wellness resources.
Yeah, awesome. Thank you to all of you. I'm a strong advocate and member of all three. Wes, do we have any, we have just a couple of minutes left. Did we have any questions in the chat or in the Q&A?
No questions in the chat. There's some good background information on what certain states have done that would be helpful. But this has been great. Sarah, thanks for the plug for the PSAP tour. And there's going to be opportunities to do things like that. The other thing I would say, in the past, the Institute has helped arrange PSAP tours when staff or elected officials are back in their home state or home district. So happy to do that too. It's another way to connect locally, but still get a sense of what is going on in your center. And I think everybody on this call has probably heard the saying, if you've been to one PSAP, you've been to one PSAP. So they're very different, each one you go to, and it's helpful to see what each faces as far as issues go.
Yeah. Since we have no questions, I just want to say thank you to all of our panelists. Great insight and conversation today. So thank you, everybody, for your time and attention. And I think with that, Wes, I guess we're done.
Yeah, thanks, everyone. Monica, great job. Appreciate all the panelists.
Thank you.
Take care.